The headlines. Hyperbaric Medical Society Research Institute to conduct study on aftermath of COVID-19 infection on underwater divers. The Hyperbaric Medical Practitioners Society of Nigeria, HMPSN, on Wednesday disclosed plans to partner with the Nigerian Institute of Medical Research, NIMR, in a study that will determine the lung function of underwater divers who have survived COVID-19.
Basically, diving is about going underwater. And while you're underwater, one of the key things is you need to be able to breathe. So you get an alternative source of breathing, and it puts a lot of pressure on your lungs. So divers are like all of us, they walk underwater, but when they get COVID-19, what becomes of them? How does a COVID-19 affect their lung, underwater, under pressure? And that's why it's important for us to know what is the sequelae of COVID-19 on divers, how are they affected? Are they able to safely go back underwater to walk? Do they have to take a particular number of time off work? Do we have to watch out for a particular lung volume to be sure they will be safe underwater? Those are things that we need to start looking at, and the only way to get to the bottom of some of these things is through research.
President of the group, Dr. Kayode Ogunleye, stated this when the society paid a courtesy call to the premier medical research agency in country.
The real purpose of our visit here is to seek collaborative efforts with the Institute as regards research into hyperbaric medicine. Our primary organ itself, as an hyperbaric physicians, is the lung. The lung is very important to us. So the lung function test and research and collaborative efforts with NIMR myself. And we live in the post-COVID era. We're trying to develop, look into research outcomes as it relates to sequelae, as regards to complications, as relates to people infected with COVID itself.
Addressing the management of the Institute, he said the visit was to seek collaboration on medical research as it bordered the health status of divers who have survived COVID-19, as well as to push forward studies that will show the usefulness of hyperbaric medicine in the treatment of ailments like stroke, bone injuries, sickle cell anemia, amongst others.
Hyperbaric medicine, I know sir, you're trained, you already understand. We deal with decompression illnesses, hyperbaric injuries and that. But there are other uses that can help the country with the area of bone healing, even stroke. So we are moving towards the area of having a proper hyperbaric treatment facility in country like they have in South Africa and the rest of the world.
Responding, the Director General of the Institute, Professor Babatunde Lawal Salako, commended the group for being proactive enough to think of the drawback of the COVID-19 infection on people who dive.
It's very instructive that early in this pandemic, I would say so, that your organization has started thinking about what could be the drawback, so to speak, of COVID-19 infection on people who are diving.
Noting that the major pathology of COVID-19 is in the lungs, he said it is of utmost importance to study the aftermath of the infection on divers whose survival underwater is dependent on their lungs.
Because the major pathology of COVID-19 is in the lungs. And that's what kills a lot of people. And if it's the same lung that people who are diving are using to survive underwater, then it makes sense for us to begin to put two and two together to see if before or after the lung is safe. For us as the research institute, we are always willing to break the new ground.
We've had some divers that are, shy and afraid of testing for COVID-19. For many of them, diving is their means of livelihood. And so we are not looking to take anybody's means of livelihood away. What we want to do is to make it safe for them and their families. Make it safe for them to be able to dive for as long as they want to. And that's why it's important that we're able to check them, we're able to tell how safe they are, I mean, it is for them to continue to go underwater. Sometimes it may not even be it may not be that you can't dive, maybe just a limitation on how deep you can dive. And those are things that we need to find out and work on and be sure that we make our water safe.
He said the Institute is willing to partner with the society, even though it's been challenged by the lack of funding.
We are always ready to partner with progressive ideas that will be very useful to policies within the country, or even for their own peculiar association, for example. We have the capacity, we have the people. Like I said, what we need more is funding. If we have that backing, we should be able to go to any length with them.
The meeting we just had with the NIMA DG and his staff and all was very, very productive. So he has opened our eyes to different ways that we can get to collaborate and work together to drive research in hyperbaric medicine and create awareness and advocacy out there as much as possible.